5 main parts are the solution bag, the fill line, the empty drain bag, the drain line, and the Y junction, with the patient connector that attaches to the MiniCap Extended Life PD transfer set with twist clamp. As you can see, the solution, the fill and drain lines, the patient connector, and the drain bag are already attached to form one complete unit. You will also need 2 ultra clamp tubing clamps, a new MiniCap disconnect cap, and a mask. You will need an IV pole or something similar on which to hang the solution bag. Place the ultra bag system, 2 ultra clamp tubing clamps, and the new MiniCap disconnect cap within easy reach. Remove the ultra bag system from the over pouch and place it on your work surface. There may be some moisture present inside your pouch. Now, check the solution bag according to SEAL, S-E-A-L. S, strength of the solution concentrate, E, expiration date, A, amount of the solution, and L, leaks. You can squeeze the bag to check for leaks or a broken frangible. Small droplets in the tubing or drain container are acceptable, but if solution flows past the frangible prior to use, or if leaks in the solution container are found, do not use and discard the units. Discard the bag if the solution is cloudy. Next, inspect the patient connector to ensure that the pull ring is attached and the frangible is not broken. Do not use if the pull ring is detached or if the frangible is broken. Finally, inspect the new MiniCap disconnect cap for the expiration date. Next, remove the transfer set from your clothing. Make sure the transfer set is closed. Let's take a look at how to connect to the ultrabag system. First, break the blue frangible on the patient connector. To break the frangible, hold the base of the frangible in one hand and the tip of the frangible in the other. Next, bend the frangible outward until it breaks. Bend the frangible back and forth 2 or 3 times to make sure it is completely separated. There should be a small space between the broken parts for good solution flow. The frangible can also be broken by holding the base of the frangible between your thumb and forefinger while pressing the tip into a hard surface. Again, you must bend the frangible back and forth to make sure it is completely separated. When the blue frangible is broken, remove the pull ring from the ultrabag system patient connector. Do not touch the sterile end where the pull ring was attached. Once the pull ring has been removed, do not reuse the solution container. Remove the MiniCap disconnect cap from the transfer set and immediately connect the transfer set to the ultrabag system. Do not touch the end of your transfer set. Hold the transfer set steady and twist the ultrabag system patient connector until it is firmly secured. Next, let's take a look at how to drain. First, clamp the fill line with an ultra clamp tubing clamp. Next, break the green frangible near the solution bag using the same method you used to break the blue frangible. Hang the new solution bag on the IV pole. Place the drain bag in the drain position, below the level of the abdomen, with the shiny side up. Open the transfer set to drain. Remember to check the drain fluid for cloudiness. If it's cloudy, contact your dialysis clinic immediately. When drainage is complete, close your transfer set. Let's proceed to the next step, which is to flush. First, make sure your transfer set is closed, and then remove the ultra clamp tubing clamp from the fill line. Count to 5 slowly and let the new solution flow into the drain bag. Then, clamp the drain line with the ultra clamp tubing clamp. To fill with the ultrabag system, simply open the transfer set and allow for solution to flow from the solution bag. When fill is complete, close the transfer set and clamp the fill line with the second ultra clamp tubing clamp. Signs of too much peritoneal dialysis solution in your peritoneal cavity may be stomach enlargement, a feeling of fullness, and/or shortness of breath. Treatment is to drain the peritoneal dialysis solution from the peritoneal cavity and call your healthcare professional. Finally, let's take a look at how to disconnect from the ultrabag system. Open the MiniCap disconnect cap package and look at the sponge in the cap to make sure it is wet with povidone iodine. Be careful not to touch the sterile sponge. Disconnect the ultrabag system from the transfer set by twisting the patient connector. With the transfer set pointing down, hold the MiniCap disconnect cap up and immediately twist it onto the transfer set until it is firmly secured. Let's review the 6 steps again. Prepare supplies. Connect. Drain. Flush. Fill. And disconnect.